So it would be great that we can great. So very warm welcome to all our participants who have joined us today. Thank you so much for joining us today. Well, we are all set to begin with our today's webinar. A very warm welcome to all our participants present here today. This week, our webinar aims to deliver informative and practical content on various health-related topics. Our goal is to help our audience gain a better understanding of these issues and take steps towards improving their health and well-being. It is no secret that our current lifestyle and dietary habits have had a significant impact on mortality rates and immunity. Unfortunately, many diseases that were previously only seen in individuals in their 50s are now affecting younger people, and stress is one of the main contributing factors. One of the most prevalent diseases associated with these lifestyle habits is diabetes. HRAI welcomes you all to the 2023 Dialogue Masterclass series on the topic An Overview about Diabetes and Lifestyle Diseases. To know more about HRAI and its event, I would request all our participants to visit the link and details posted in the chat window. Request all the participants to kindly follow the webinar guidelines mentioned in the chat window. It would be great to have all the participants' feedback. We'll be running a poll before the Q&A session. Request all our participants to kindly give your feedback on the session. I now take the privilege to introduce our esteemed speaker for today, Dr. Rajiv Kumar Damani, Senior Consultant, Internal Medicine, Zydus Hospital. Dr. Rajiv Damani is a highly experienced MD in internal medicines with over 30 years of clinical experience. He is currently serving as a senior consultant at Zydus Hospital in Ahmedabad and has previously worked as a consultant at Rajasthan Hospital, Apollo Hospital, and Sal Hospital. Dr. Damani is also an honorary physician and cardiologist to the HE Governor of Gujarat. Aside from his clinical practice, Dr. Damani is a recognized speaker and has delivered lectures at various corporates, including Reliance Jio, ISRO, Plasma Research, PDPU, Nokia, HDFC, Cape Gemini, and Rotary Club. He is also a certified lifestyle coach. In 2005, Dr. Damani had the honor and privilege of treating Mr. Rahul Dravid. You can also follow him on LinkedIn. The link for the same has been shared in the chat window. Without taking much time, I now hand over the platform to Dr. Damani. Over to you, sir.
Namaskar. Am I audible, visible?
Yes, sir, you are audible.
Okay.
And visible too.
Good afternoon, everyone. Right at the outset, I am thankful to HRAI for providing me this opportunity and platform to have a dialogue with you all on this Monday afternoon. I am equally thankful to all those who are present in this chat today, having risked their own courage to hear me out today. So, thank you very much once again. Today, I'll talk about an overview about diabetes and lifestyle disease. Am I audible clearly and the slides are visible?
Yes, the slides are visible and you're audible.
Okay, right. So before I move further, as you all know, March, this is a month of Women's Day celebration, International Women's Day. So before I really jump into the substance of my talk today, maybe I would like to share a few quotes with respect to Happy Women's Day. And one of my personal favorite, which I like, is, without her, even a hero, HERO, hero is a zero. And women, obviously, they are the backbone of the society. I always say that women is like what fragrance is to flower. And if I have to define in my medical terminology, women is what the pacemaker is to the heart. So women acts as a wonderful wife, outstanding friend, marvelous daughter, adorable sister, a nurturing mother. So maybe though belated, but still a happy Women's Day to all the women present out here today, hearing me out at this moment. A sweet noon to you all again. Today, as already we have been discussing, I'm going to talk about diabetes and lifestyle diseases. When we talk about sweetness, we all know it's related to a carbohydrate metabolism, the disease, wherein we have a high blood sugar in the blood. So that's what is diabetes. As we move further, to be very honest with you, I mean, when this idea of talk had come, I was a bit nervous because I was knowing I was going to talk in front of a esteemed elite class of group. And as they say, speeches are like babies. Speeches are like babies. They are easy to conceive, but difficult to deliver. But as they say, if I is replaced in illness, if I in illness is replaced by WEV, illness gets converted into wellness. So then I thought today, maybe I and you, we all together will definitely do something good and better. So moving further, as we talk about diabetes, as you all know, sugar is very sweet. But the only thing which I can mention here is there is nothing sweet in having diabetes. There is nothing sweet having diabetes. Now, the importance when I talk about diabetes, why it's this so much of significance when we talk about diabetes, particularly in the form of disease. The matter of great concern, what exactly at this stage which prevails is India has been labeled as a world capital of diabetes. India has been labeled as a world capital of diabetes. And as you could very well see in these slides, at this currently what we have is about 463 million people of diabetes in the world, out of which 87% they reside in India. And as per the American Diabetes Association, what has been projected is by about 2045 is going to rise to 153 million. So this would be almost amounting to somewhere near 70% incremental rise, which is a matter of great concern. So this is the magnitude of the disease. That's why it is so important for all of us to know about it and take the adequate measures so that we can try and curb the menace of the prevailing disease. Now, when we talk about the diabetes, maybe a bit of a history of diabetes. When you talk of diabetes mellitus, it has two words. Now, these two words, then when they are put separately, they mean separate. Mellitus would mean like, sweet, something like honey. And diabetes would mean like siphoning, passing through. And the basic metabolic aspect which has been observed in diabetes is there is a sweetness in the urine and there is excessive urine, whereby this has derived its nomenclature as diabetes mellitus. And 1674, a physician that noted sweet flavor of urine in patient with diabetes. Even when we look into our Indian culture, Sushruta, the father of medicine, he had noted in about somewhere around in the 4th century a sweetness in the urine, and he had labeled the term as Madhumeh, which is still prevalent as a Indian name of the disease, Madhumeh. In 1917, the oral glucose tolerance test was introduced by Jacobson. For quite a long time, the 2-hour GTT value was generally a diagnostic and predictive value with respect to diabetes. Of late, now we have different modalities of testing which are available, which I'll touch as I go through my talk. So this is about the impact, the significance of the disease, and that's why it's so important. Now, what exactly do we mean by diabetes? What is diabetes? Diabetes mellitus is recognized as a syndrome, a collection of disorder that has hyperglycemia or high blood sugar and glucose intolerance as their hallmark. Glucose intolerance being either due to insulin deficiency or because of impaired effectiveness of insulin action, or for that matter, a combination of both these processes, which thereby leads to the disease diabetes. Now, there are different types of diabetes classified, but when you talk about the major component which we clinically are concerned and we deal in day-to-day life is a type 1 diabetes, type 2 diabetes, and the gestational diabetes, which is related to pregnancy. Now, what is type 1 diabetes? Type 1 diabetes is a chronic lifelong disease that occurs when pancreas does not produce enough insulin to properly control blood sugar. Just before this, maybe can I give a brief short recapitulation of the carbohydrate metabolism? It is metabolized by insulin, which is produced by pancreas gland in the normal human body. By any chance, if the pancreas is malfunctioning or it is not functioning, the insulin production is hampered, which thereby leads to the disease diabetes, which is termed as diabetes type 1 diabetes. Now, the cause probably is still uncertain, but what has been identified is the body's own immune system attacks and destroys the beta cells of the pancreas, which secrete the insulin, thereby it manifests as a diabetic disease. Now, other name for this disease is also as a juvenile diabetes or insulin-dependent diabetes. Now, when you talk about type 2 diabetes, which are formally known as a non-insulin diabetes, is a disorder characterized by high blood glucose in context of either insulin resistance or insulin deficiency. Again, the probable causes which have been postulated are either there is a lack of insulin or insulin resistance, whereby rendering the available insulin ineffective, manifesting into a disease process. As we were talking about insulin resistance, if you will really look, this picture demonstrates the insulin resistance, wherein even though the insulin production is there in the body, however, the cells are not receptive, which leads to a condition called as insulin resistance, which manifests as hyperglycemia, leading to the disease. This picture is a demonstration of how and what we would define as a insulin resistance. Gestational diabetes is a third main form, and it occurs in pregnant women without any previous history of diabetes. This is also a major concern, because what has been statistically advocated at this stage is about 25 to 30% females in pregnancy, they encounter this disease, gestational diabetes. Now, when we talk about diabetes, an important aspect is what are the risk factors, or what are the factors which would really make somebody vulnerable to get this disease. A strong family history is a very important aspect when it comes to as a risk factor. Overweight, obesity, sedentary lifestyle, habitual physical inactivity, previously identified impaired glucose tolerance. Those who have been identified with impaired glucose tolerance or has been labeled as pre-diabetic, they stand a high vulnerability of going in for a full-fledged disease. People who with hypertension or hyperlipidemia, meaning to say high blood cholesterol, they also stand in a high vulnerable bracket. Now, when we talk about these risk factors, If I further modify and classify them, it would be into the modifiable risk factors and the non-modifiable risk factors. With respect to age, family history, they stand as a non-modifiable risk factors. However, the rest all overweight, physical inactivity, high blood pressure, hyperlipidemia, they group into the modifiable risk factors, which would really in itself mean that they can be really managed by the personal effort. Now, again, this touches about the pathophysiology of the glucose metabolism. When we take our normal food, the body obtains the glucose from three places. Either there is the intestinal absorption of the food, or there is a glycogen breakdown in the muscle or liver, which leads to release of glucose in the blood, or there is a gluconeogenesis, which would mean new glucose production from non-carbohydrate substance, predominantly because of fat. These are the three ways where the body glucose is being provided. Now, insulin plays a very, very critical role in balancing the glucose levels in the body. It can inhibit the breakdown of glycogen, whereby stopping the glycogen in converting itself into glucose, leading to hyperglycemia. The excessive blood sugar in the body is being promoted, and insulin helps to transport that into the fat and muscle cell so that they can be stored in that. This is how insulin maintains the role of glucose metabolism. Insulin, as we discussed earlier, is released by the beta cells of the pancreas. And in case of high insulin level, the high blood sugar level, there is an increase in the insulin secretion, whereby to maintain the glucose homeostasis in the body. If the amount of insulin available is insufficient, or if the cells they poorly respond to the effects of insulin, or there is an inherent insulin resistance, then the glucose will not be absorbed properly in the body, and this is going to lead to persistently high level of glucose in the body, poor protein synthesis, and breakdown of fat storage, trying to maintain, and this is a normal pathophysiology when we talk about high blood sugar and diabetes mellitus. Now, when there is an excessive blood glucose concentration in the blood, that it is going to cross the kidney threshold of reabsorption, thereby it leads to excessive glucose in the urine called as glycosuria. This increases the osmotic pressure of the urine, whereby which again further leads to increase and frequent urination, which is known as polyuria. And because of the excessive urination, there is a loss of the volume in the body, whereby which leads to the reabsorption of the body fluids, which further promotes dehydration, which leads to increased thirst, what is known as polydipsia. Now, this is important, trying to understand the commonest symptoms of diabetes disease. Now, when we talk about the diabetes disease, as we were discussing earlier, frequent urination, excessive thirst, that is known as polydipsia, frequency of urine. Then again, because there is a fat loss, there is a protein loss, it leads to excessive weight loss, thereby which leads to excessive fatigue, excessive weakness. Diabetes further, it can lead to non-healing sores. It can lead to infection on the private parts. It can lead to reduction in the libido also. And if the uncontrolled diabetes further progresses, it can affect the eyes also, whereby leading to blurred vision, or even to extent of blindness if the disease is not properly managed and controlled. So the commonest symptom what as clinicians we encounter is for frequency of urine or unexplained weight loss. Now, how do you diagnose the disease? How is diabetes diagnosed? The modalities of diagnosing of diabetes are simple: measuring the blood sugar. The entities which are of importance here is the fasting blood glucose, fasting blood sugar, FBS, 2 hours after meals, that is known as a postprandial blood sugar, PPBS, HbA1c, that is the glycosylated hemoglobin, which is a very, very important diagnostic tool in itself when related to diagnosis of the disease, HbA1c or the glycosylated hemoglobin, and oral glucose tolerance test, particularly when we are talking about the gestational diabetes or the diabetes which is manifest in pregnant ladies. Now, the defined criteria, when would one be labeled as a diabetic patient? If the HbA1c is greater than 6.5%, or if the fasting plasma glucose is more than 126, or the 2-hour plasma glucose level is greater than 200 milligrams. So all the diagnostic criteria are important. Based upon a single diagnostic test, it would be really a fallacy to label somebody as a diabetic patient. That needs to be confirmed again. In case if the clinician encounters a random blood glucose greater than 200 milligram, further it can be confirmed with respect to whether the person is having diabetes or not by HbA1c or by fasting and postprandial blood glucose level. So this is how the diabetes is diagnosed. Now, once you know what is diabetes, what are the symptoms of diabetes, how it is diagnosed, God forbid, if really one lands up with diabetes, then when you talk about the management, the monitoring of the blood glucose becomes very, very significant aspect. So what are the cutoff points which have been suggested? If the fasting blood glucose is somewhere in the range of 80 to 110, that is pretty desirable. 111 to 125 would stand there good, but if it is greater than 125, that's certainly a bad diabetic control. Similarly, postprandial blood glucose, blood sugar, anywhere between 140 to 160 is desirable. 160 to 180 would be considered as a reasonable control, but if it is more than 180, certainly the clinician needs to look into that. Similarly, with respect to glycosylated hemoglobin, it has to be under 6, which would be that you have achieved the therapeutic goal. If it is anywhere between 6 to 7, maybe it's an acceptable level, but more than 7, certainly the one really that needs to see the clinician, and probably the treatment modality needs to be modified further. What again becomes a very important aspect with respect to diabetes, one has to have an annual eye checkup because diabetes is known to affect the eyes. Because the diabetes is known to affect the eyes, and I was already discussing earlier, if it is uncontrolled, one may land up with, if it is uncontrolled, one can land up with total blindness. Diabetes can affect the kidneys also, leading to kidney damage and kidney failure. That's why the kidney test of measuring of a microalbuminuria becomes very, very important. Diabetes uncontrolled can lead to vascular damage and compromised blood supply to heart or even to the feet, whereby even to the extent that if it is not controlled, one needs to ampute the toes or the feet. So a regular feet examination, particularly with respect to vascular compromise and or neuropathy element, monitoring of the blood pressure. Those who have been found to be diabetic, they tend to run a high vulnerability of developing blood pressure. People who have high blood cholesterol and who are diabetic, this duo again tends to be a further high risk factor of developing complications. So cholesterol monitoring also becomes a very, very important aspect. So now when we talk about diabetes, a very significant entity which has been not labeled, which have been labeled very, very recently, pre-diabetes. Now we encounter a lot of patients with the diabetic results which are not fulfilling the criteria of diabetes, but still on the higher side, they very well fit into an entity known as the pre-diabetes, which is used for individuals where the fasting glucose or the impulse glucose is on the higher side. They in itself run a very high risk factor for diabetes and cardiovascular diseases. Usually the people who have been found vulnerable are high overweight with high abdominal visceral fat, high cholesterol, low HDL, and hypertension. Those who have regular physical inactivity, the immediate first degree relatives of diabetes, women who have delivered a baby of more than an average normal weight, those who have low HDL cholesterol, those who have high blood pressure, those who have a family history or a history of cardiovascular disease, or those who are overweight, type A personality, they are, and those who have shown a HbA1c of more than 5.7%, they are labeled as pre-diabetic patient. These are the cut points when we come to diagnosis. Those who have a HbA1c 6 to 6.5%, they are high risk of developing diabetes. Impaired fasting glucose or impaired glucose tolerance, they are labeled as a pre-diabetic. The significance of pre-diabetic condition is they run a significant chance of converting themselves into disease if the proper steps are not being, or the rules of the game are not being followed. With respect to diabetes, pre-diabetes testing, it remains the same. HbA1c, fasting sugar, or the 2-hour blood glucose monitoring, and in case of certain needs, the oral glucose tolerance. Now, when we talk about diabetes, there is one, as we talk about hyperglycemia, there is one entity which is known as hypoglycemia, wherein the blood sugar that tends to go on the lower side. So if hyperglycemia is important, so is hypoglycemia, wherein the blood sugar goes very low. Particularly, it becomes of a great significance when treating and monitoring the patient of diabetes. The symptoms which are commonly encountered when a patient presents with a low or develops low blood sugar is excessive sweating, blurring of vision, lightheadedness, sudden fatigue, or even to an extent one may go into unconsciousness of varying degree, semi-coma to coma also, if the blood sugar is not being attended immediately. So this is also an important aspect to know when we talk about diabetes. Hyperglycemia, hypoglycemia itself is also a very, very important aspect. Now, in a nutshell, if I talk about diabetes, what really becomes very, very important aspect when you talk about the management of the disease. When I say management, it includes the diagnosis and the therapeutics also. So when you talk about that, we have already discussed about the diagnosis of the disease. When you talk about the treatment aspect, the two important pillars of the treatment are the pharmacological treatment and the non-pharmacological treatment. Kindly bear in mind, both are equally significant and important. So when you talk about the non-pharmacological aspect, the nutritional management is very important. A good balanced nutrition, and obviously if one has a diabetes, it would be a low carbohydrate diet, no sugar diet. As we were talking, usually associated obesity or physical inactivity. Diabetic, they have to regularly exercise, trying to maintain their weight to optimum. Equal important aspect when you are treating a diabetic patient becomes the monitoring of the patient and the monitoring of the disease, and equally important, monitoring of the risk factors. Pharmacological treatment. When I talk about the pharmacological therapy, I'll not go into the much technical details of this, but yes, treatment modalities of various aspects are available in form of oral medications, in form of injectables, also insulin of varying degree and varying type of available. That is going to be your clinician's choice to decide what is good for the concerned respective patient. One again very important aspect becomes the education of the patient. Now, when we talk about the education, knowing about the diabetes for the person concerned becomes a very, very critical and significant aspect. I am really reminded of a saying here: a wise man knows what to do. A wise man knows what to do, but equally important, the wise man knows what not to do. So that is the importance of education, particularly with the myths which are associated with the disease, the common man myths. one really need to ablate these myths. When I talk about the myths, the commonest prevalent myth about diabetes is sugar can be eaten in diabetes, sweets can be eaten in diabetes, family history does not have any impact in diabetes. There is only one form of treatment of diabetes. All diabetes, they need to be taken insulin. They need to be put on insulin. So these are one of few of the myths which overweight does not have anything to do with diabetes. Diabetes doesn't have to do anything with exercise. So these are a few common myths which really need to be dissolved. That's why the education of the person is very, very, very important when we talk about diabetes. So as I was discussing about the disease with you all, very, very important aspect, as I mentioned in my earlier slide, is the impact of the disease, the magnitude of the disease. And as we have moved further, I talked about diabetes, the pathophysiology of the diabetes, the diagnostic aspect, the monitoring aspect, the symptoms of the disease, and more importantly, the management of the disease, particularly with respect to the non-pharmacological measures, which is very, very important to one and all. So when we talk about diabetes and we really shout so loud about the magnitude of the disease, the time has come that for you and me, one and all, we all together come together and we really resolve that we all together are going to beat diabetes. BEAT, beat diabetes. When I say this, B stands for be physically active. E stands for eat a healthy diet. A again is equally very important. ABCs, know your ABCs and control them. Control HbA1c, control your blood pressure, control your cholesterol, and no smoking by any means. No smoking, no tobacco. And T stands for, again, a very important pillar. Take your medications regularly and stay in touch with your clinicians regularly to be monitored with respect to disease. So when I talk about this at this stage, may I invite you all, ladies and gentlemen, to join me in management of diabetes with respect to A to Z of diabetes. I repeat again, A to Z of diabetes, where A stands for HbA1c, B stands for blood pressure, monitoring and control, C stands for ensuring that there are no complications, or if at all, they are well treated. I stands for eye, monitoring of the eye and vision, particularly with respect to diabetic retinopathy. Careful examination of the feet, F stands for feet, and monitoring of the feet for vascular disease and the neuropathic aspect. G stands for the gestational diabetes, which we discussed earlier, diabetes in pregnancy. H stands for hypoglycemia, low blood sugar. I stands for insulin. There are different types and varieties of insulin available to treat the disease. And as I said, I'm not going to touch that technicality. Let it be the clinician's domain. J stands for juvenile diabetes, that is the type 1 diabetes, or the insulin-dependent diabetes. K stands for kidney. Kidney is very monitoring of the kidney functions and ensuring that no kidney damage occurs with respect to the diabetes disease is again an important aspect. L stands for lipid profile, that is the cholesterol. Monitoring the cholesterol and maintaining to the optimum level becomes an important aspect. Meal planning is again a very, very important aspect. Short, small feeds becomes a very, very important aspect. And of course, what cannot be taken in diabetes has not to be taken in diabetes. That is the important aspect. When you talk about the N, the nerve damage, neuropathy aspect, so monitoring of the neuropathy and the neuropathic symptoms. Those who have diabetes, they are vulnerable to get infections, and one of the common infection is the oral infection. So O stands for oral hygiene. P stands for pancreas, which is the backbone when you talk about diabetes, because pancreas secretes the insulin, which is the most important hormone to maintain the blood glucose. Q stands for quit smoking. Smoking or tobacco chewing in no form is allowed or advocated. S stands for self-monitoring of blood glucose. Now, when I talk about SMBG, the self-monitoring of blood glucose, there are devices available which can be attached to the person, and he can monitor the blood glucose at this stage for about 2 weeks. You can download the app, and your mobile can monitor. It can be monitored for 15 days. So SMBG. T stands for the treatment aspect. I'll not touch much of the technical aspect of the treatment, but I can assure and ensure, yes, we have a good form of treatment available against this disease. U stands for understanding the disease, and more importantly, educating our own self with respect to the disease so that we don't fall prey to any WhatsApp university news. W stands for weight, maintaining the weight to an optimal level by regular exercise and a healthy diet. X stands for expert advice. Kindly seek expert advice when and as needed. Please don't delay that. That's a very, very important aspect. For those who are diabetic, there are certain tests mandatory to have a ear check, particularly the fundus, the feet, the kidney test. They need to be monitored annually. And Z stands for sleep. Adequate sound sleep is again a very, very important pillar and a cornerstone when we talk about maintaining a very good healthy state. So this is about A to Z of diabetes. I would assume, all of you are with me at this stage also. Maybe with the raise of hand, kindly make me aware that you are all with me right now at this stage before I move further, right?
Yes, doctor.
So when as we are talking about diabetes now, with important aspect when I talk about diabetes is I would like to come and touch about a lifestyle disease. Now, see, to be honest with you, as a clinician, one of the commonest question we faced wherever we go these days is, "Arey, bimariyan bahut badh gayi, diseases bahut badh gayi." I'm really sorry to say, ladies and gentlemen, diseases have been around ages. Diseases have been around ages. It is now that they find the conducive bodies to feed and fester upon, thanks to a deviant lifestyle. So when we talk about lifestyle diseases, what exactly do we mean about lifestyle? Before I move further, I would really like one and all to join me here today. What exactly do we mean by health? What exactly do we mean by health? I would request the organizers if they can unmute people, and people would like to share their view about what do you mean by health? Anybody from the audience? Hello? Hello? Am I audible?
Yes, doctor. If any participants would want to unmute and say, definitely they can do so, or post their queries in the chat box.
Okay. So do I move further?
Yes, doctor. You can go ahead.
That really made me nervous. People didn't like me questioning them. Fair enough. All right, I'll move further. So let me conclude. Health. When we talk about health, very, very important aspect, health. What exactly we mean by health? According to World Health Organization, health is defined as a state of physical, mental, and social well-being, and not merely the absence of disease or infirmity. Kindly pardon me, I is missing in, health is defined as, but what is important, again, I repeat, a state of physical, mental, and social well-being. So not only the physical health is important, the mental and social well-being is also equally important. So that these three aspects, they constitute and they attribute to a sound health. So this is what the health is defined by World Health Organization. Now, what do you mean by lifestyle disease? What are the lifestyle diseases? The health problems that react to changes in the lifestyle, diseases that are caused partly by unhealthy behavior and partly by other risk factors. they are known as lifestyle disease. Now, I can understand this would be a very confusing this thing, and at this stage, I am reminded about from a dialogue of a movie, which I'm sure probably all would have seen it, Munna Bhai MBBS, and this slide reminds me of the dialogue of a movie, a circuit भेजे में chemical लोचा हो गया है. This slide represents that, but let me assure you, the idea is not to frighten anybody, but what is very important is what I really want to underline here is the impact, the gravity of lifestyle disease, the gravity of lifestyle diseases. Now, the types of lifestyle diseases. When I talk about types of lifestyle diseases, the cardiovascular disease, stroke or the paralysis, diabetes, cancer, depression, musculoskeletal disorders, particularly may relate to the HR associations, the desk job, sitting with the laptop, sitting with the desktops, overweight, obesity, arteriosclerosis, and cardiovascular disease. Now, the risk factors for cardiovascular disease, again divided into two groups, controllable or the modifiable, uncontrollable or the non-modifiable factors, which would be hereditary, gender, sex, wherein you cannot do anything about that. But certainly the control factors can be looked into, modified, and can be very well controlled so as to avoid the devastating effects or the complications of the disease, which would be tobacco use in any form, high blood pressure, high cholesterol, sedentary lifestyle, excessive weight, obesity, stress, or drug abuse. So these are the risk factors which contribute to lifestyle, particularly the disease aspect. The risk factors, again, when you talk about the on its all, they are almost the same, but heart disease, smoking, high blood pressure, cholesterol, type A personality, where it is a pretty anxious personality. When you talk about cancer, smoking and alcohol, or even some certain environmental or the occupational factors, they become important here. When you talk about stroke, smoking, high blood pressure, cholesterol, diabetes, particularly with respect to diabetes, overweight, sedentary lifestyle, cirrhosis of liver, alcohol becomes a very, very important causative agent when you talk about cirrhosis of. So what really becomes important is to prevent the lifestyle diseases, as simple as that, maintaining healthy lifestyle. Maintaining healthy lifestyle. Now, how do you do? The pillars which are healthy diet, healthy eating patterns, healthy diet, healthy exercise. Researchers, they have shown that at least 150 minutes per week of moderate intensity exercise is very, very important. Relaxation aspects, which will really calm down, which would convert your stage of fight and flight to stage of tranquil and calmness. Avoid all forms of addiction, smoking, tobacco, alcohol. So healthy nutrition, healthy exercise, healthy breathing pattern, relaxation, and avoiding of all substance abuse. Now, this pictorial is an example of the various form of exercise, walking, jogging, gym, cycling, and for that matter, even dancing becomes a very important aspect with respect to aerobic exercise. Whatever one likes, suits, one has to adhere it on a perennial basis. Formulate, as you always form good habits, kindly formulate this also as a part of your daily regime so that to benefit with respect to health. If I diagrammatically represent that, relaxing becomes very, very important because when you have a healthy breathing, it really relaxes you, reduces the stress and anxiety, leads to calmness. It reduces the tension, improves your focusing, thereby rendering you all positive aspect with respect to a healthy health. In your Upanishads, they have also written long back, Prasanna Atma Indriya Manaha Swastha Itvidhayate. Happiness in mind, senses, and soul would keep one healthy always. So this is a very, very important aspect when we talk about the healthy lifestyle and a proper normal health. This reminds me of a story long back in the Western world, even when the medical world was not advanced so much. In a suburb in the Western world, where a beautiful 13-year-old girl was diagnosed as blood cancer. Doctors had declared the 2 months life expectancy. The entire town had gathered together for felicitating the girl, but because the atmosphere was so morose, nobody could speak up. Amidst this atmosphere, this 13-year-old girl stands up and she says, "Why are you unhappy? I know I have blood cancer and I'm going to live for 2 months, but pain is inevitable, sorrow is optional. Pain is inevitable, sorrow is optional." Because life is 10% of what happens to you and 90% how you react to it. Life is 10% of what happens to you and 90% how you react to you. Because as they say, it may not matter much what happens to you. What matters more is how you react to what happens to you. Please remember, ladies and gentlemen, you always have a choice. You always have a choice. We again, as a clinician, wherever we go, the common question which have been put across to us is ye khana, wo khana. Even the relatives in the outdoors say aa khao ke na khao, ye khana ki nahi khana. People are so worried about what to eat. People are so worried about what to eat. But let me tell you here, ladies and gentlemen, it matters less what you eat. What matters more is what eats you up. आपको क्या खाना है उसकी चिंता है, लेकिन आपको क्या खा रहा है आप उसकी चिंता नहीं करते हैं. So it matters more what eats you up. So eat right, exercise right, diet right, breathe right, stay healthy. If you regularly exercise, you eat better, that gives to a positive thinking, and the net result and the net gain is you always feel good. Because good health is a crown on a head of a well person that only the sick person can see. That only the sick person can see. I'm sure everybody knows this character, and the most important aspect which it depicts is always stay cheerful, keep smiling, always stay cheerful, because laughter, they say, is the best medicine. Thank you all for your patient listening and lending your ears today. And this is the beautiful apple, healthy mind, body, and spirit. There's an age-old saying, ladies and gentlemen, I'm sure you all know, an apple a day keeps the doctor away. But I always say this is the incomplete saying. This is the incomplete saying. An apple a day keeps the doctor away, and if the doctor is good, keep the apple away. Now, this is a small video. I'll see if that plays. Is the video playing? No.
No.
Just give me 1 second. I'll try, or else I'll give it up. I think.
Yeah, it's playing now.
The impact of exercise. So as I said, gentlemen, all the time I said, ladies and gentlemen, choice is yours. Choice is yours. You have to plan out how would you like to see yourself further down the line after 10, 15 years. Thank you. Thank you very much for your patient listening. And I'm thankful to you all. I'm thankful to HRAI. I'm thankful to Mr. Peterson Pereira. And last but not least, I'm thankful to Dr. Ankita Singh for having provided me this platform to have a dialogue with you all on this afternoon. Thank you. Thank you very, very much. The floor is open for question now. Thank you.
Thank you so much, Dr. Dakhmani. Before we move to the Q&A session, we'll be initiating a poll. Request all our participants to kindly share your feedback on our today's session. Hello. So while you are doing so, request all our participants to kindly post your questions in the chat window. Once again, I thank all our participants for joining our session today. We have received a lot of inquiries about the e-certificate offered by HRAI. You can claim your certificate by sharing your details. When we say details, that is your name and the session attended in an email to the email ID provided in the chat window. Please ensure that you send us your details by the end of this month. We will email the e-certificates to you based on details received. Okay, so Dr. Damani, we have received a couple of questions. I would like to have them read out to you. So we have the first question that has come from Neha. The question is, how can the long-term complication of diabetes be prevented or managed?
Yes, wonderful. Yeah, all right. So this, in other words, would amount that the person who has already developed diabetes, now what are the do's and don'ts? As simple as that. So, Madam, first of all, thank you very much for such a wonderful question. Now, the rules of the game are very simple. They apply same for everything. Once if the person has landed up with diabetes, what really becomes very, very important here is, the monitoring of the disease and ensuring that the disease is under control. That's the top line, right? Now, when you talk about that, the pharmacological aspect, the medical aspect would be taken care of by the clinician. Now, what is very important on one's own part would be looking after the modifiable factors. A healthy exercise, sticking to a strict dietary regime, a good breathing pattern, good breathing exercise, relaxation techniques, and periodically checkup of the blood sugar and monitoring, at the same time adhering to the treatment regime and adhering to the advice as per your clinician. So now if you keep the disease under control, you certainly are bound to, let me put it in the first word, bound to prevent the development of complications. Number one, if at all, God forbid, one lands up into complication, seldomly one is going to see that the gravity of the complication. So that's why this is very, very important. For that matter, the latest evidences, people have started prevailing. I mean, particularly with respect to the newly diagnosed diabetic patients, if they are aggressively treated, and of course, along with the treatment, the other aspects are being taken care of. Quite a significant number of new patients we have found that they really go into the remission state of the disease also. So obviously, when I say they land up into remission of the disease, the complications are much far down the line, if at all any.
Thank you so much, Dr. Damani. Very helpful, and I'm sure this answers to the question that Neha had. Our next question, which is from Mickey Srivastava. I have a query about potatoes. Does it really contribute to high sugar level or obesity or weight gain?
Right. Okay. That's a very, very nice question. I mean, in my talk, when I was talking about the myths also associated with the diabetes also, one of the common myths we face also is, people they tend to believe if you eat potatoes, you'll end up with diabetes. Or if you eat sugar, you develop diabetes. No, that's not the case. Those who are not diabetic, they can eat normal sugar, they can eat potato. Now, particularly when you talk about the people who are already diabetic, yes. So when you talk about the dietary compliance, no sugar in all forms, that's an important aspect because it's a direct sugar. Second is, as diabetes is a carbohydrate disease, carbohydrate metabolism. So what again becomes very, very important here is, what becomes very, very equally important here is, so low carbohydrate diet. So when you talk about potato, it's a very high carbohydrate product. So so we don't say the potatoes are not allowed, but definitely it would be in moderation. The same thing really applies a lot of query associated with potato that comes is with respect to rice also. So rice basically it's a very easily digestible food, but again it has a very high caloric carbohydrate index. So rice and potato, they are not totally restricted, but certainly they with a pinch they are allowed in moderation.
Thank you so much, Doctor. Now we have our next question that's from Bhavna. What are the symptoms of pre-PCOD?
Pre-PCOD?
Yes.
When you talk about PCOD, the commonest symptoms would be irregular menses, mood variations during the menses. It would be associated with some PMS symptoms also. Usually what have been shown is these patients, they are on the overweight side. Quite a number of patients, they would present with excessive hair growths or pimples also. So that is with respect to PCOD. When you consider the treatment aspect of PCOD, the top line which always says is a healthy exercise and weight reduction. And of course, if need of medical treatment, let it be as per the clinician's choice.
Thank you so much, Doctor. I'm sure our participants are getting a lot of information and knowledge out of this session. As I see questions coming in, we have one more question that has come up from Kabir. How smoking impacts your health, especially it comes to heart, like when it comes to heart, does running and brisk walking help keep diabetes in check?
All right. So two questions in two parts. I'll give the answer. Particularly one is the smoking aspect. So 1 minute. When you talk about the smoking aspect, as I was saying, I quite often give a talk on health talks, particularly healthy lifestyle, and the pillars are diet, exercise, breathing, maintaining the weight, and the last and the important pillar in that is addictions. So whenever I talk about that, maybe I can talk in detail about diet. I talk about in detail about the exercise. I talk because it has been advocated also, as I said, at least 150 minutes in a stress management. But when I touch the aspect of addictions and smoking, I just, gentlemen, I have to say only one line: there is nothing good about smoking. So better let's not talk about that. So we don't go into the discussions of quantity or quality or whatever it is. Nothing good about smoking. So जिस घर जाना नहीं, जिस रास्ते जाना नहीं, उस पे पाँव रखना ही क्यों? As simple as that. So nothing good about smoking or tobacco. So it is bad. As simple as that. It is bad. It impacts the health by all means adversely. I don't think anybody would really try to debate about this. Now, does running and brisk walking? Yes, certainly running, brisk walking. So as we discuss about any form of aerobic exercise, any form of aerobic cardio exercise is good for health, is good for heart, is good for diabetes, good for weight, good for blood pressure. And more importantly, if you do a regular exercise, it really helps to helps you to stay even stress-free, because it reduces the stress also. So I'm sure the HRs are going to be happy because they can extract better yield out of you. I mean, if you are healthy mentally also.
Absolutely. And in fact, yes, strictly no to tobacco, and that's something which we all need to have that understood well. That doesn't help at all. Yeah, so moving to our next question, that's from Tushar. People say that diabetes and heart related problems are hereditary. If it is so, and any of my parents have these disease, what kind of precautionary measures I can take to keep these disease away from me? And that same applies to me too. My parents, my
And
father is a diabetic.
Absolutely. I mean, before I really go in and answer this question, when you talk about hereditary, to be very honest with you all, I mean, hereditary probably was a tool in our armamentarium, and probably we can't really figure out the cause. Probably this could be a tool. Yes, it's hereditary. But at this stage, I mean, hereditary really has lost its teeth, because practically every house has a disease. So the best way for all of us is to pray for good genes. That's the best way for us. I mean, now when you talk of, yes, diabetes, blood pressure, heart disease, they are hereditary. Hereditary definitely influences the impact. So if one has a family history of the disease, one would run a very high, they are in a high vulnerable bracket of catching disease. But having said that, if one has a hereditary aspect, so the person would land up with the disease. That's not always necessary. If the other side of the coin is equally true also, those who don't have a hereditary, they also land up with those diseases. But certainly world over, it has been scientifically established, there's sufficient data to prove those who have a hereditary or a familial history, they run a high chance of contracting that disease. So now if somebody has a say for instance, let's talk about diabetes. If you are referring to diabetes, somebody has a diabetes in the family. So how to try to stay away from the diabetes? I really love this question, because this is a very, very important thing. Try your best so that you don't land up with the disease. Now, with respect to that, what really becomes important is, maintain a healthy lifestyle. When I say maintain a healthy lifestyle, the branches which would really percolate down would be good exercise, healthy diet. If one is overweight, maintaining the weight to optimum, adopt a healthy breathing or a relaxation technique, so that helps you out. And because you have a hereditary family history of a disease, maybe a periodical checkup and monitoring with respect to the disease aspect also becomes very, very important. So the mental health and physical health both will have to be considered when you discuss about the preventive aspect of the disease, because prevention is always better than cure, is the age-old saying. So if you really have a family history, the triggers are already on, better start doing something so that you, before the disease really gets over you, you get over the disease head on.
Absolutely. Thank you so much, Dr. Damani. Our next question is from Pooja. What common health challenges we may face in early stage of diabetes, and how do you know based on the symptoms that we have diabetes or heart health issues?
See, when you talk about the early stage of the diabetes, usually, diabetes is a chronic disease. So if at all the complications one would like to see with respect to the disease would be, they would be later in the stage, down the line after a few years of disease, and especially if the disease is uncontrolled or not looked after properly. So that is one aspect. Second is, when you talk about the symptoms, when you talk about the symptoms of the diabetes disease, see, let me put it very straight away. The first and the common symptoms of diabetes disease is there are no symptoms. That applies true to high blood pressure also. There are no symptoms. That is why diabetes and blood pressures, they are labeled as silent killers. So one may not necessarily have any symptoms, and they may be diagnosed as a very bad or a high diabetic or very high blood pressure. So that is one aspect. Now, when we the things which one may try to keep in mind, that if you really show these symptoms, that would mean that there is a probability of diabetic disease and one needs to really get it checked urgently, would be excessive unexplained weight loss, excessive fatigue or excessive unexplained weakness, excessive urination, particularly more at night, nocturia, increase in thirst, polydipsia, or if somebody has a cut or an injury and the wound is not healing in the prescribed time, or there are non-healing sores or ulcers, they would raise alarm with respect to diabetes. So therein one definitely has to get himself or herself checked with respect to disease to ensure whether we are, if at all, dealing with the disease or not. That is one aspect. Second, if as she was talking about the challenges with respect to early stage, if you develop diabetes and it's the early stage of the disease, throughout the stage of the diabetes, kindly adhere to the advice given by your clinician, follow the rules of the game. But in the early stages, if you really take proper measures, stick to the clinician's advice, timely consultation, timely checkup, following all the health principles, there are fair chances. I would take the liberty to use the word, probably you could reverse it also. You could reverse this also. So that is why, apart from the pharmacological aspect, the non-pharmacological modalities, treatment, and lifestyle are so significant and important.
So it's all about managing and changing the kind of lifestyle that you have been maintaining.
Absolutely.
That's
Yeah.
the better way to fight.
If you want to stay healthy, follow the rules of the game. As simple as that.
Absolutely. It's not like you bend the rules of the game, but it's better to follow the rules of the game.
Yes. It's not like that you bend the rules of the game and then you expect the HR to favor you.
Absolutely. It was a great session. Thank you, Dr. Damani, for the highly informative and captivating session. Your expertise and insights were truly enlightening. Key takeaways that we had from this session, I'm sure all of us have learned a lot, are beat diabetes, the 5 component of diabetes management. You entirely kept the session totally glued, wherein we all were learning at every stages of your slide. There were information that came up. The content that you linked towards, be it a movie dialogue or stuffs that came up, definitely were pretty informative, and it helped us to bring in scenarios where we experience in our day-to-day lives. It's all about, this is something that we experience, be it our parents or our relatives that have gone through these scenarios, and sure, that is something which triggers the information that we would have received. Thank you so much. And yes, it's been a pleasure to have you out here today, and I'm sure our participants have had a lot to learn and take away from this session. Before we conclude with our today's session, we would also want to thank our event partners, that is Geisha, NASSCOM, COE, LinkedIn Local, Talgro, TLE, and WICCI for supporting these HRAI events. To know more about them, request you to kindly visit the link provided in the chat window. Thank you once again, dear speaker, and our participants for joining us today. Do join us for our next masterclass tomorrow on finding your own self. That's by Dr. Chavi Damani on the 28th of March, 2023. Request you to kindly register for this event at the link mentioned in the chat window. Also to join the Dialogue 2023 WhatsApp chat group through the invite link shared in the chat window. That's it from us today.
Thank you very much. Thank you to all.
Thank you so much.
And stay healthy and stay fit.
Thank you. Thank you so much, sir. Thank you, Shyam. We can hereby conclude with our today's session.